Hi, good morning, everyone. Today, I would like to present before you a policy called Aging Gracefully, the Road to Fall Prevention in Senior Care. The policy is mainly focusing on to prevent falls in senior care facilities. So, my policy setting is definitely aged care homes, and the audience I'm focusing for this policy is aged care facility staff. What is the purpose of this policy? The purpose of this fall prevention policy is to establish guidelines and procedures to prevent and manage falls in care homes, promoting the safety, health, and well being of residents. I would like to quickly include some of the definitions. What is meant by fall? A fall is defined as an event which resulted in a person coming to rest inadvertently on the ground or floor or other lower level. Quality is a degree to which health services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. And what is meant by safety? The avoidance or reduction to acceptable limits of actual or potential harm from healthcare management or environment in which healthcare is delivered. Have a look on the data from 2019 and 20. This indicates how critical it is to put strategies in place to lower falls in assisted living facilities. According to report, fall in residential aged care facilities resulted in 27,900 hospitalization of residents who were 65 years of age or older. And the AIHW's 2015-16 disease expenditure study indicates that over 4 billion is spent annually on these kinds of problems. These findings show the necessity of taking steps to prevent fall injuries. And now the principles. And what is meant by resident-centered care? The residents in an aged care home facility will be having different mobility. Different residents will be having different mobility and different health condition. So according to the needs of each resident, we should maintain proper quality and safety measures to prevent falls for each resident. And what is meant by multidisciplinary collaboration? It is not only the responsibility of the personal care assistant to look after whether the falls are prevented or not, but it is also the responsibility of other staffs in the care facilities like nurses, care manager, health educator, and general manager, and all even the cleaning staff, all must be responsible and should work together to make sure that the falls are prevented in care homes. And what is a risk assessment? What is mean by risk assessment? What are the risk factors for falls? Like this could be individual based, individual factors like lack of mobility. Some of the residents may be having medications that will resist their mobility. Environmental factors like the flooring and also lack of handrails. And what is meant by individualized care plans? As I mentioned before, each individuals in the resident care homes will be different based on the mobility and also medication and also health factors. So, during handovers, we should make sure that each individuals are having different care plans and they are looked after according to their needs. What is meant by education and training? Whenever there is a need in a care home facility, there is a need of continuous education of the existing staff, and also we need to train new staffs so that the falls can be reduced. When a new staff is enrolled, we should make sure that the new staff is trained well. And also, this is not only for newcomers, but also for the existing staff. We should make sure that there is continuous education platform. And the environment and safety equipment, we should make sure that the flooring in such a way that it reduces the possibility of fall, and also make sure that the safety equipments like Sara Steady and stand-up machine and the lifters are all working well, and adequate number are there in each care home. And the communication and resident engagement. We should always make sure that our resident is happy. They are the ones receiving our services. So they could give better feedback on our services. So we should always make sure that we have a good communication and resident engagement. What is mean by continuous monitoring and evaluation? That means that a different person will be having different mobility on different days, because sometimes as health issues increases, the person may not be as mobile as he was 2 or 3 days before. And when the health conditions become okay, uh, he may be back to his earlier mobility. So we should have a continuous monitoring, and we should also provide equipments according to their needs on different health conditions. And what is meant by data driven decision making? Data driven, we should always uh, collect data based on the data for the falls, and also data regarding the health condition of each resident, so that we could provide adequate measures to prevent their falls, like proper equipments to help to help in their mobility. And what is meant by cultural sensitivity? And different residents living in care home will be from different cultural background. Some prefer to include their native languages while we are providing care, and some also prefer persons from their background to take care of them. So including those factors can also be helpful to to provide better resident satisfaction. These are the principles that are included in this policy. And what are my and now I would like to focus more on the process or procedures included. First one is assessment and risk identification, and then prevention strategies. Okay, incident reporting, rehabilitation and recovery, continuous monitoring, communication, staff training and competency, documentation and record keeping, quality assurance and improvement, external resources and referrals, evaluation of interventions, follow-up and long-term care. Assessment and the risk identification. We should always have a look at what are the risk factors and whether the risk factors are eliminated or not. And we should also focus on who are in a high risk, which we should also identify which resident are in higher risk of fall, and also provide adequate measures like use of SARA study and all other equipments, and even the four-wheeler walker or the community chair according to their needs. And what are the prevention strategies? So the main reason for the fall is a lack of the strength in the hands and their feet, so that because they when during the old age their muscles will be weakened, and they won't be able to have enough strength in even standing up. So to prevent that from happening, we should also include exercise and mobility programs, and also we should have reviews on the medications they are taking, and also regular eye and hearing assessment, and environment modifications like handrails, non-slip flooring, and proper bed heights. Incident reporting. As soon as an incident happens, we should report soon to the nursing staff, so that adequate measures are provided to them, and we can provide adequate measures as soon as possible, so that further incident can be reduced. And we can also focus on what is the reason behind this fall, and can also prevent this from happening again. And rehabilitation and recovery. What does mean by rehabilitation and recovery? As when a fall happens, we should make sure that the resident is treated well, and during the rehabilitation period, we should take care of them properly, and we should also make sure that they are recovered well. And even we should also make sure that the mobility is recovered as it was before. And what is meant by continuous monitoring? Continuous monitoring means because the residents in care home will be all aged persons. So their health conditions are unpredictable. On some days they will be very healthy, happy, and nice, but in other day they won't be as healthy as the day before. So we should make sure that we should always be continuously monitoring on the health conditions and also their mobility factors to reduce the falls. And the communication, what is we should have in good communication in between the staff members and also with the residents we are for whom we are providing the services, so that further falls can be prevented. And staff training and competency, and the all staff must be trained regularly, and when a new equipment or new policy is implemented in a particular care home, each staff should be we should make sure that each staff are getting enough training so that these measures can be implemented fully. And what is meant by documentation and record keeping? As soon as any fall happens, we should document it, and we should also keep record, because these record keeping will help in tracking the health conditions of the residents living there. And if the same fall is happening again and again, we should take notice of that. We should take notice of the health condition, and we should provide adequate measures like even hospitalization in some cases to help in improving the health condition of the residents. The quality assurance and improvement, we should make sure that the equipments which we are providing, even from the bed for Willy Walker or any other instruments or any other items that are provided in the resident care home, are having good quality, and according to the need, we should also make improvement to the machines machines or items which are provided in the care homes. And evaluation of interventions, follow-up, and long-term care. This all means that we should always have a continuous follow-up mechanism, follow-up strategy to help to prevent falls from happening. And now I would like to point out the roles and responsibilities of the responsibilities. First, I would like to point out care home management, a role overseeing the policy implementation and making sure rules are followed in order to prevent falls. Responsibilities: allocate funds for fall prevention devices and employee training, oversee the creation and upkeep of the policy. Healthcare workers such as doctors, nurses, and therapists, role clinical evaluation and provision of fall prevention related care. Responsibilities: perform fall risk assessment for residents, create personalized care plans, observe and modify interventions as necessary. Direct care staff like personal care assistant, nurses, role manage daily care and put fall. I'm sorry. Manage daily care and responsibilities to avoid falls and guarantee resident safety, adhere to care plans, make routine safety inspection, and keep an eye out for potential environmental threats, report any incidents of near falls or changes in condition of residents as soon as you notice them. Residents, roles: taking an active role in preventing their own falls. Responsibilities: engage in conversation about care planning and fall risk assessment, adhere to suggestions and techniques provided in their care plans, tell staff members of any changes in their health or well-being, take part in exercises or activities that are advised to preserve your strength and balance. What are the Now I would like to point out the alignment with Aged Care Quality and Safety Commission standard. Standard 1, consumer dignity and choice. By participating in talks about care planning and fall risk assessment with the residents and their families, encourage residents to participate in and make choices about fall prevention measures. Standard 2, ongoing assessment and planning with consumers, maintain regular reviews and updates of fall risk assessment and care plans and updated based on changing needs. Standard 3, personal care and clinical care, integrating fall prevention techniques into clinical and personal care tasks. Verify the staff's ability to apply these tactics with expertise. Standard 6, feedback and complaints, provide individuals and the family a way to voice a concern, and offer comments on fall prevention. Take feedback into consideration to keep improving fall prevention techniques. Monitoring and evaluation. Monitoring and evaluation is a main step in any plan, in any policy making. Because as soon as an incident, what are the steps in monitoring and evaluation? Incident reporting and analysis, because we need to always keep the track of falls and also recording all the falls and events. Even we need to record the near miss fall, the data collection and documentation, like a fall risk assessment, care plans and interventions and their outcomes, regular audits and inspections, review of the care plans, quality assurance meetings, staff competency assessment, feedback, and improvement mechanism. That's end of my lecture. Thank you everyone for listening to my lecture, and also thank you for your valuable time to spending with me. Thank you.